Hi, I'm Beth. I'm one of the laser therapists here at Era Clinic. Today I will be talking to you and showing you our laser hair removal treatment and discussing the importance of consultation and patch test. So before I would start any treatment, I would begin with a thorough consultation, which is looking into your medical history just to check that there's no underlying health conditions or anything that's going to prevent or restrict us from going ahead with treatment. As long as that's all okay, we would then begin with a patch test ready for first session. So the next stage is where I'll then cleanse the area to be patch tested and I'll mark up a section to be treated. The laser that we use is something called a diode laser. So this means we can treat any skin type and pretty much any type of hair that there is. So when patch testing, I'll just assess the hair, have a look to see where to mark up, like so. And then from here, we will move on to the next stage. So the next stage is now where I'm just going to trim the hair. For a patch test, we would ask you to come in with the hair grown, which makes it easier for us to assess the type of hair that we're working with. But for any other session throughout treatment, if you could shave the hair 24 hours beforehand, so we've got the appropriate hair length and type to work with. So now I've set my laser and everything's all at the appropriate settings for the skin type and hair type. Now I'm going to apply some cool gel to the area, ready for the laser, and then I will also pop on my protective goggles, ready to begin treatment. So now I'm going to begin treatment of the patch test. With the patch test, it's very quick and pain-free. So I'll just count you in. 3, 2, 1. The patch test has been carried out, we would ask you to allow 48 hours after the patch test to just make sure that there's been no skin reactions. As long as everything's been okay, then we'll all be good to go ahead and begin your treatment course.